check in. We go over different topics in plastic surgery and I get to answer your questions. Today we're going to be talking about this flash sale that I've been, you guys probably have seen me talk on Instagram and all our social media platforms is running this week. So I'm going to explain the importance of these items that we are including if you book a BBL this week. With me, it's including Vaser and it's including a recovery kit that includes the BBL pillow and the massages. So I'll go over specifically why this is so important for your recovery and a little bit about recovery in general for BBL and the importance of diet and exercise. And I'll touch a little bit on weight loss, which is something that has been popping up a lot, especially since we are seeing the popularity of GLP-1 or semaglutide, Wegovy, Ozempic, and all of these medications on weight loss, and people asking if I lose weight, what's going to happen with my BBL. So let's start with the Vaser. So what's Vaser? Vaser is an energy device that it can be added to BBLs, and I do recommend it a lot. We've been using Vaser here at Pure for the past year, and we have seen the results being impressive. Very, very good technology. I do recommend it almost to anyone, but especially for patients that had a prior liposuction or BBL before, because it really helps with breaking that scar tissue fibrosis that can be in those cases. Also for patients that have anemia or borderline hemoglobin levels, definitely recommended for those because it decreases bleeding, so it decreases swelling and bruising afterwards. So what is it? It's basically ultrasound energy. It basically, what you do is the steps in the surgery are I first infiltrate the tumescent fluid, which is saline, with epinephrine. Epinephrine helps vasoconstrict or constrict the blood vessels to decrease blood loss during liposuction. After injecting the tumescent, the first step is the Vaser. Vaser is a cannula, and at the tip of the cannula, it transmits ultrasound energy, and it basically kind of breaks the fat and coagulates the blood around it, okay? And it creates this energy throughout where you're passing it. So it is time-based, so it depends on the surface area and the amount of tumescent fluid at the time, but more or less we can do 10-15 minutes in the front, 10-15 minutes in the back, and that definitely then is when I start doing the liposuction itself, which is suctioning the fat. This just breaks everything up, and then the second part is the liposuction, okay? And I do see the difference drastically when I'm doing the liposuction in cases that I'm doing Vaser. The amount of blood loss is less. The mechanical force that I have to implement, so the tissue is less traumatized and the skin is less traumatized. So yes, of course, patients are going to see less bruising, less swelling. So I do recommend it for everyone. And if you book this week, then you're getting the Vaser for free added to the procedure. So I mean, if you're thinking about getting a BBL, like this is the time to book, to take advantage of this. So less swelling, less bruising, and because this energy kind of breaks that tissue around it, it increases the collagen formation, and this is what causes the skin tightening effect. So it's not only for your recovery, and it's not only for the decreased bleeding and the early recovery period, but it's for your results. The results are so much better because the skin attaches back and you can get a better silhouette with it. So that's what's Vaser and why I think it's very important. I do recommend it for everyone. The BBL pillow is basically your friend for 6 weeks after you get this surgery. And why do you need a BBL pillow? Because the fat that was just transferred to the butt needs to grow new blood vessels. While it grows new blood vessels, that fat shouldn't get any pressure because it's gonna die. If you sit, and the blood vessels are not there, there's no oxygen supplying those cells, fat cells, so the cells die. So the fat retention rate is less. Fat retention overall is about 80%, 70 to 80%. So we always lose a little bit of fat, But if you start sitting, the chances are that you are pushing the fat cells to die more, so you may end up with a 50-40% survival rate. And yes, a lot of people are like, I did a BBL and I sat the next day. I mean, yeah, you can do a BBL and sit the next day and don't put any compression and don't do any massages. But what are the odds, right? When we're talking about surgery, we're talking about odds. You can have one patient do this and then, I didn't do any massages and I had no fibrosis and I sat the next day and I have all my fat there. Well, that's one case, right? I'm looking about numbers and statistics and percentages, right? And that's why I recommend my patients to try to get the best results possible to follow these guidelines, okay? And the BBL pillow is just your friend to help you drive, work, and all of that in that 6-week period. There are different types, whatever you choose is fine. The most important aspect of the BBL pillow is that I don't like the round ones because I think that it'll put pressure on your hips, so that's the important part. This one is rectangular, so it won't put pressure on the sides. So that's why I recommend this one. This one has a little bit of a curve where the thighs go. Patients say that it's more comfortable. There are other ones that are completely rectangular. It's more of a personal preference. But the important aspect is that it's sturdy, that it's hard in the sense that when you sit, it doesn't collapse all the way. Because if it's very soft like a pillow, then you sit, then your butt's going to be touching the chair. The point of this is that you put it on the edge of the chair, and when you're sitting, your thighs are touching this, so you're going to be like this, and your butt is not touching the chair or the sides, so there's no pressure here. So you can work, you can do like rest during the day without anything touching the butt and hip area. Okay, so the BBL pillow is included, and if you're traveling, you are gonna need it for the flight back home. Okay, so take that into consideration if you're booking your surgery, if your surgery is coming up. Okay. And why I say from 2 to 6 weeks, because the first 2 weeks there's a lot of swelling. You're still very weak from the procedure, so it's better to stay off of it. You can use it for a little bit if you really want to just like rest, but not for prolonged times for those first 2 weeks. Then at 2 weeks you can start using it for work or for anything that you need until 6 weeks, and at 6 weeks you can sit. It is very, very common to hear that at 6 weeks when you sat, it felt weird, it was tender. It's going to get better. It's just your body and your nerve endings, all of these new cells that grew there and that have new vascularity and new nerve endings are just more sensitive to the pressure that wasn't there before. So it'll get better, and you can continue to sit in it after the 6 weeks to soften it up. Massages is, if there is one thing that is key for the recovery of lipo-BBL is massages. It definitely decreases swelling, it decreases the fluid buildup, decreases the chances of getting a seroma. So when that fluid starts to form up, if you don't massage it and you don't distribute it to the lymphatic system, that's gonna make a ball fill up with fluid, and the tissue is going to heal around it. So if you're not massaging it, that's going to become permanent. And even if you drain it, the tissue doesn't distribute the same, and you can end up with irregularities, lumps, bumps, and end up with fibrosis. So this is something that you can't avoid or jump or don't do because it is not worth it. Then don't get the liposuction, because it's gonna look worse if you do a liposuction and you don't treat it accordingly on the post-op period, and you end up with irregularities, lumps, bumps that are even worse to treat once they become permanent and chronic. Okay, so this is the 777 rule that I tell my patients that it's the easiest way to remember the massages. I usually recommend around 20, so if we break 21 in 3 parts, it's 777. The first 7 every day. Okay, so the first week you should be getting everyday massages. Then second week, so the next 7, you do every other day. That's gonna take you to a 2-week window of every other day massages, and you get 7 in that 2-week period of every other day. And then the following 7, you can do once a week, or maybe every 3 to 4 days, kind of stagger it, maybe a Monday and a Friday, and then a Tuesday, kind of stagger it to like longer, so you can then continue that until around the 6-week mark. Usually at that point, most patients don't need further massages, but everybody's different. Like if you end up having any fluid accumulation, any area that you want to treat more aggressively, then you may need to extend those massages. And at that point, at the 6-week mark, is when we evaluate the skin, and we may end up recommending other modalities during your massages, like radio frequency, red light therapy, wood therapy, cavitation, and all of that. Okay, so it is a process. This is the initial post-op massage protocol, but then further on, it all depends on how your skin and body behaves. Okay. And let's talk a little bit about diet and exercise. I know that we always encourage our patients to get on a healthy diet and exercise regimen even before the surgery, so you can be healthy for the surgery itself and then maintain your results long term. But what do we mean by that? So in the early post-op period, it's very important to focus on a high protein diet. Proteins help heal, okay? So our body's natural wound healing response is based on proteins and inflammatory mediators to get everything healing. So if you're helping your body heal, it's getting those proteins in, okay? And the other important aspect is the healthy fats. Healthy fats are going to provide a good environment and good nutrition for those new cells to survive, which is what we want, right? We want to avoid pressure with the BBL pillow, but then also provide that nurturing through the diet to get the best fat survival. So what is the diet that we're the healthy fats that we're talking about? Mainly salmon, avocado, nuts, yogurts. All of those are very, very good to try to keep high. It's not that you're just gonna eat this for 6 weeks, right? It's just incorporate those and prioritize those in your meals, okay? And that's pretty much it. What about later on, right? Like life continues, and a BBL, it's a life-changing surgery, but then 6 months to a year, or even 2 to 3 years after, life happens. You have fluctuations in weight. What happens with your BBL? So once that fat it survives and it's there in your butt, that's there. It's there, right? It's not gonna go away or disappear, but it is gonna fluctuate with your natural weight, right? If you gain weight, those fat cells will expand, and the projection and hips are going to expand. With that also comes skin elasticity. If we gain a lot of weight and you gain mass or fat cell mass in the buttock and hip area, you may see some drooping of the butt because the fat cells have some weight on it. So you may see that. So that's why we always recommend you try to keep your weight long term, because if it increases, it is okay to increase 5-10 pounds, but if you gain more than that, you are going to see a difference, especially on skin quality, elasticity, cellulite, and the appearance of the butt and hip. And what if you lose weight? Okay, a lot of people are like into this medications, or they're starting a protocol for weight loss and calorie deficit. Just gonna imagine your entire silhouette is gonna shrink. So it's not that you are going to lose your butt without losing fat or dimensions on your waist and upper body. Everything is going to shrink accordingly. So what I've heard about my patients after a couple of years that have had weight loss, significant weight loss after a BBL, the consistent answer is, yes, I lost buttock and hip width, but everything else also shrank, so the shape maintained, okay? And that's basically the goal and also the outcome that most of my patients with weight loss are looking. It's like, yeah, I mean, the butt, if you're just measuring your butt and you just see that, yes, it's gonna measure less, but also your waist is gonna measure less, your upper body. So everything is shrinking when you're losing the weight. So proportionate wise, the shape maintains, okay? If you do it or not is a personal decision. If you decide to do it, what do I recommend? Again, focus and prioritize your proteins. Some people on the GLP-1 medications, Ozempic, semaglutide, they're just injecting it, and that's gonna make you eat less. So you are putting your body in a caloric deficit, which is what's gonna cause the weight loss, right? This is directly what, if you wanna lose weight, you have to put yourself in a caloric deficit. That's basically it. You can see ways of doing that, many ways, but bottom line, if you want to lose weight, you have to eat less calories. The intake has to be less, and the GLP-1 drugs help you do this, right? But if you're just doing that without adjusting what you're eating, you're probably going to be eating more carbs and less protein, and that's what's going to happen is the muscle mass is going to shrink, and you don't want that, because that's when the skin elasticity comes. You want that muscle supporting the skin. So you want to focus on weight training, focus on protein intake, so you can try to maintain that shape without seeing a lot of skin elasticity and drooping of the bottom hip, okay? Let's review again. Flash sale, this week only. Vaser included with any BBL booked. Vaser and recovery kit, which includes a BBL pill and a massage, okay? Let's get some questions now.
Oh, we're fire. Yes, we have a lot of questions. Dr. V, and let's start with this one. It says, can Aveli be done awake? And can I combo it with another procedure?
Definitely, both things are true. So you can't do it awake here in the clinic. If you're doing it awake in the clinic, then no, you can't combo it with much else. But you can combo it with Botox or another non-invasive treatment. But yes, it can be done with local anesthetic, and then a small incision and basically breaking up those bands. Or you can add it to a surgery. So it depends on what surgery. BBLs specifically, it depends. Most of the time I say no. But if it's a mild cellulite, we could. Because when we are being very aggressive releasing the bands, that creates a lot of empty space that when we inject fat, it can create what's called a blowout deformity, kind of bumping the skin out, okay? That creates fat necrosis. It's just a lot of space. So it depends. But with a mommy makeover, I've done it with breast, I've done it with like arm lift and Aveli. So any other procedure really, you could. The BBL, it depends.
How much for a mommy makeover? That's one of my dreams come true, getting it done by you.
Hi, that's awesome. Give us a call. The mommy makeover depends on what is it that you need. So it's hard to just tell you a number because it fluctuates depending on your stats, on if you want a breast reduction, breast lift, implants, no implants, and yes. So if it's an extended tummy tuck, if it's a regular tummy tuck, and all of that. So give us a call or go to our website. You see this is in our website, pureplasticsurgery.com. There is a link, virtual consultation form. You fill that, and a coordinator will give you a call right away.
What technique do you use? Do you use the ultrasound for liposuction?
So I have a talk about the ultrasound specifically with BBLs that I go into differentiating what ultrasound energy, which is Vaser, and ultrasound technology or imaging is to visualize where I'm injecting the fat. So Vaser, which is the energy to break the fat, I don't use it in every single case. I do encourage it. And if you book a BBL this week, it will be included. I do advise it to be added, but it is not included in every single BBL lipo case. Ultrasound imaging to visualize when I'm injecting the fat, definitely every single time I'm transferring fat to the buttock. So every single BBL I use the imaging technology to make sure I'm injecting in the subcutaneous space and not in the muscle.
How do you decide who needs a mesh bra during breast lift augmentation? How does that work?
Very good question. So the internal bra or the bra mesh, there's different brands and different kinds. The one that I use is called Galaflex Mesh. And it's basically an absorbable mesh that you put in the lower pole of the breast, like a hammock, supporting that breast lift or breast reduction, breast lift with implants. Who's a candidate for the procedure? Basically, anyone getting a breast lift, breast reduction, or implants could add Galaflex. I don't think it's cost effective to add in every single case. So who do I recommend considers this? Number one, massive weight loss patients. Massive weight loss patients tend to have more droopiness and less good skin quality. So more stretch marks, thinner skin, so the support of the skin is less. So in those cases, I do recommend adding Galaflex or that mesh for supporting the lower pole in breast lift with implants, breast reductions. The other cases that I usually recommended is patients that have had already a breast lift or breast reduction and they have droopiness after the breast lift. So if you had a breast lift and in a year or in 2 years the breast drooped again, the chances are your skin is not supporting that lift. So I do recommend adding a mesh to get better support.
Do you do fat graft for a minor breast augmentation?
Yes, that is a possibility, fat transfer to the breast. I did one last week. She's super happy. The only thing I always explain to my patients that are interested in fat grafting to the breast is number one, the fat take or the fat survival is not as good as in the butt. What does that mean? To achieve a cup size difference, most of the time you need more than one surgery. Okay, the majority of times it just plumps and gives more fullness without adding volume, a cup size volume. And the other thing to consider is that when we're transferring fat, and this happens in the buttock as well, if the fat doesn't survive, it may translate into fat necrosis, which may show as cysts or masses. In the butt, nobody cares, right? If you have a cyst or a little lump, nobody really cares. But what happens if you have a little lump in the breast? Then we need to do a mammogram, we need to do a biopsy to make sure it's not breast cancer. So it is not that fat transfer to the breast increases risk of breast cancer. It is that increases the risk of having lumps, bumps that we need to be checking and biopsying. Okay.
I had my mommy makeover 6 months ago, and I'm obsessed with my results.
That's awesome. Send me pictures, please. I love to see.
But
let's
I
go.
do have a minor dog ear. What can I do about it?
Yes, no worries about it. Very easy. Send us a picture. If you still have Clara, that's the easiest way. Send us a picture of the area, and that can be fixed under local anesthesia here. Just numbing the area like in the dentist and like excising that excess tissue, removing it. Awesome, you guys. Thank you. Thank you so much. This is the last week you're going to see me with the gobble gobble hat. Okay. Thanksgiving is coming up and I'm not going to be here next week. Okay. So no Tuesday tips next week. I'll be seeing you guys the first week of December. I'm just in shock that we're already almost in December. It's crazy, guys.
It is.
It is so crazy. So I'll see you guys in December. I hope everybody enjoys Thanksgiving and have a beautiful time, family, friends. Keep it safe, eat a lot. I'll see you guys in December.